We bear witness to a healthcare system that often values profit over people, and literally hundreds of thousands of Missourians are uninsured and lack access to quality, affordable health care. Faith leaders minister to individuals and families every week that are impacted by this inaction. We're not talking about people we don't know. We're talking about people that we see every week. Working families struggling to make it paycheck to paycheck must choose between seeing a doctor or providing health care for their children or putting food on their table. Too often families are saddled with insurmountable medical debt because they cannot afford the care they need and the kind of service and providers that they should be having access to. With so many people working at poverty wages and struggling to pay bills, this crisis is actually escalating and getting worse every year. People of all faiths share common hopes. Being able to afford a doctor when they are sick, health care that puts people first, being able to live a long, healthy life. This hope cannot be realized when we fail to provide appropriate access to health care system for all of our citizens. Regular people are struggling across our state. Since Missouri legislature cut Medicaid in 2005, more and more families have gone without critical health care services. Currently, eligibility for Medicaid in Missouri is the lowest in the country, as you know. A mother with 2 children who earns more than $3,700 annually is not eligible for Medicaid. If you're one of the many in our state with a minimum wage or low-paying job, you are automatically without health care. We are called to maximize our health coverage for all people, especially for the least among us, for those that have little recourse. They're the kinds of people that seldom get to show up for an event like this or testify because they're trying to survive in a minimum wage job, and they can't get free from that job for fear of losing it. In 2013, the Missouri legislature failed to answer the call by choosing not to expand Medicaid for hardworking families throughout our state. That means that many people fall into that coverage gap. They are not going to receive coverage through Medicaid or through the health insurance marketplace. So we come as a faith community just to say that our legislature needs to put aside politics and do what is right for our state and for our most vulnerable citizens, and expand Medicaid now. Another year, 2, 3 is too much pain and too much suffering on behalf of our citizens to let that happen. I appreciate the chance to share with you today on behalf of the faith community. I'd be happy to answer any questions you have.
Representative Pearson.
Just to make a statement, Mr. Chair.
Yes, proceed.
And that statement is simply that I want to thank you for your testimony representing the voices of faith, and I thank you for coming today.
After our experiences in education, anytime in the education committee, anytime somebody says they want to make a statement, I get nervous. Further questions of this witness? Seeing none, thank you for your testimony here today. Dr. Miller.
It's an honor to be here, and I actually would really prefer to address the issues that you are most interested in and questioning. So I invite you please to interrupt me with questions. You've been living and breathing Medicaid policy discussions for a couple of years now. And if one beautiful thing about this forum is that it's multidisciplinary, and that brings a lot of richness to it. And so there's no question that's too simple or naive. So please let me know off the bat or throughout my very brief presentation if you have questions. Briefly, I'm a primary care doctor. I work at a community health center. I do internal medicine for adults and teenagers. I believe very, very strongly and always have about a notion of healthcare equity, that patients deserve really, really high quality medical care. And I also believe, regardless of their ability to pay, and I also believe in common sense of, like, we got limited funds, let's use them well and not waste them. and I cringe when I see waste. So, very briefly, med schools do a really good job of feeding the egos of young doctors. They imbue this sense of self-importance, and I must confess that I've met too many arrogant doctors, and I would like to think that I'm a little bit more unpresuming. But you graduate from medical school, you become a doctor, and you think you can conquer the world, because people have been telling you that for 4 years, like, oh, I can make that diagnosis, and I'm right. I made a brilliant diagnosis. I got a pill for that. I can fix that. And you feel like you can make a really big impact on people. I sit in front of you humbly today and acknowledge that you and your legislator partners can take better care of my patients than I can. I can diagnose the PTSD and I can select the perfect 4-drug regimen for PTSD, but none of my efforts or my expertise comes to fruition if the meds are unaffordable. I believe in preventive care, being smart, treating something from the beginning so it doesn't explode and become a bigger problem for a patient, more expensive later. I had a talk with internal medicine residents last week. It was a mentorship talk. It was a room full of 20 internal medicine residents. And it was about primary care, and most of them don't want to do it. And I wanted to make it really interactive and relevant to them. So I gave everyone a piece of paper, and I said, I want you to write down your questions about career in primary care. And I want you to write down, what would you dread if you select a career in primary care? And half of the points that were returned to me that all of us sparked a really interesting discussion. Half of the points were, don't you just burn out with a lack of resources? Because if you choose to become a specialist instead, you become a subspecialist cardiologist, you become an electrophysiology cardiologist, the only patients who make it through the door are the patients who have a ticket, patients who can pay. So it's interesting how this dynamic, limited resources, can shape the primary care workforce. So I am very, very lucky to have received medical training, and I received really good training, but my education didn't start until I moved to Missouri 11 years ago. I trained at a medical school in a state where basically I had amazing teachers and I had amazing tools available to help patients. Then I start my practice. And this is where I'm mad that my education did not teach me about scenarios like, these are just patients I've had over the years. I have 1,000 stories, but you don't have time. 30-year-old bricklayer, it's the only thing he knows how to do. It's the one thing that keeps him straight in life. He goes dirt bike riding with his son, breaks his arm. Anyone will, put a temporary splint on the forearm. I personally called 12 orthopedists. He had no insurance. He was in Franklin County, and nobody would fix him. And this is not an isolated case. So do you know what happens when you have a broken bone and you don't have an orthopedist to fix it? Well, the same thing that happened 1,000 years ago, and the same thing that happens in third world countries that have no resources at all. It heals crooked. You either die or it heals crooked. So now we got a bricklayer with a crooked forearm on his dominant hand. So why didn't my medical education train me to deal with that? Another scenario. I have a patient, his epilepsy was so bad, he was on 3 medicines, and he went to the emergency room twice, because during his seizures, he had bit his tongue so hard that when he came back into the clinic, he's got half his tongue flapping on the side. So I was taught that when someone has such severe epilepsy, you refer them to a neurologist. But I don't have a neurologist, so I'm the one who has to manage his meds without proper training. I'm the one who has to figure out, do I suture up that tongue? I mean, I've sutured up other things, but I've never sutured up a tongue. And a 19-year-old female who's been on her ADHD meds, barely keeping it together, but when she ages out of Medicaid, she can't afford her Adderall anymore. And then I just see her falling apart. She lost her job at Burger King. How do you deal with that? That was not a part of my education. So, one thing that bothers me even more than not having appropriate resources for smart care is watching the wastefulness of resources. Oh, I cringe. I had a patient without insurance. She needed a chest CT to absolutely rule out a pulmonary embolus, which is a blood clot. In my clinical judgment, there was maybe a 15% chance that she could have a blood clot, but maybe it was just a pneumonia. But I couldn't rule out that 15% without a CT scan. All I needed was a CT scan. If she had insurance, I could order a CT scan. It would probably cost the system $300 to $500 for that CT scan. But I had to refer her to the ER. So when you think about patients who aren't uninsured, and it's easy to get really distant from them and just think how annoying it is, like, oh, why do these people keep going to the ER? I will tell you, not only will they go to the ER, I will hate it, but I will refer them to the ER. You will have physicians sending patients to the ER for things that could be done the same day as an outpatient. And just a couple other quick notes. In terms of the incentive to work, most of my patients who would benefit from Medicaid expansion do work. Not only do they work jobs that are incredibly hard on their bodies, and they don't have sick leave. And they make very little money, can't afford health insurance. If you want to incentivize people to work, then keep them off the disability rolls. I hate this. I hate this. This is one of the worst parts of my practice is when patients' health, even someone who has a caring primary care doctor, when their health has deteriorated due to a lack of insurance, lack of resources, lack of regular medicines, and it finally gets so bad that they ask me, hey doc, can I get will you fill out my disability form? And I realize that the only way to get them the medical care that they need that caused that deterioration is disability. And then I'll also say that most of my patients who do end up getting disability for one reason or another, they all get unhealthier. Because you know what? Working is really, really healthy. Almost all my patients who've gotten disability, they go home, they don't work, they don't have that reason to wake up at 6:30 in the morning, take that shower, get out, be accountable to other people. They gain weight, they get depressed, they use more substances. So in conclusion, one question would be like, well, what's all the fuss? Like, why don't these people just go get a job with insurance? I would personally invite you or any of your colleagues who don't have the close familiarity with this dynamic. I seriously invite you to come to my clinic. I've had patients for 11 years, and I bet if I asked each one of them and said, you know what, Representative so-and-so wants to learn more about a care delivery model, would you mind if he's or she joined us in the clinic today? I bet most of them would say yes. Come shadow me for a day, please. I'll leave you with my contact information. And on my last note, I have one patient that comes to mind yesterday as a tow truck driver. He owns his own business. He takes so much pride in it. He wears a gold chain around his neck with a little picture of a tow truck on it. Some months are good, some months are bad. And on the good months, he takes all his meds for his congestive heart failure, for his diabetes, for his asthma. If the weather's been really good and there haven't been very many car crashes and he hasn't earned very much income, then he drops off all his meds because he can't afford them anymore. And he comes back with his blood pressure high and short of breath. And so I ask you, and I ask your colleagues, that in the middle of the night, when your car breaks down and some sweet man drags himself out of bed to tow your truck or your car to the garage, to wonder if this person who is helping me, does he have health insurance to help himself? I'll stop there, and I would really welcome your questions if there are any.
Questions of Dr. Miller? Thank you for echoing comments I made last night about disability, federal disability programs and Medicaid.
If any questions afterward about that, many examples. Thank you.
I believe there's some students here. I believe there are some students here who requested.
Hi. My name is Jamie Cannon, and I live in Potosi, Missouri, in Washington County. I am a divorced mother of 5 children ranging in the ages from 5 to 10. I'm a survivor of domestic violence. My children and I stayed in a homeless shelter in Phelps County in order to escape my ex-husband, who was incarcerated before being recently released. I work full-time in home health care and also work at an auction every Friday night to earn extra money. I was elected as the Washington County Low-Income Representative for East Missouri Action Agency. I am the secretary of the Mineral Point Lions Club, and I am a chairperson of the Mineral Point Back to School program. I have my associate's degree in business management and my accounting certificate. I am looking for a job in my field. I'm also a part-time student at Jeffco, working towards my bachelor's degree. Between my two jobs, I earn about $485 every 2 weeks, which puts my family at the 39% of the federal poverty level. I am in the Medicaid gap and I am uninsured. I have back damage resulting from domestic violence. The only way to fix it is with surgery that I cannot afford. Recently, I've noticed the pain is getting worse and spreading. When I get up in the morning now, my left leg is numb. I also have had severe head trauma and I need to see a neurologist. I don't know what I'll do if it gets worse. I've been told that I could legally apply for disability and I'm only 29 years old. I don't want to be disabled. My kids are all in sports. They're constantly winning medals, making me proud, always in the newspaper. I got good kids. And I could even be a better mom if I had health care. I work hard, I try hard, and I'm doing everything I can to get by. To me, it's not fair that I can't get help. Medicaid expansion would give me the health care that I need. I've heard that the federal government will pay 100% of the cost through 2016. So Missouri is losing out on a lot of money. I don't understand why Missouri hasn't expanded Medicaid. Being that I am a single mother with 5 children, and not a single one of them in middle school yet, I have a lifetime of memories to make with my babies. I work as hard and as much as I can, but the help I need is beyond my means. One of my biggest fears is being physically confined to a wheelchair before my youngest son graduates high school. We aren't all going to like everything in this bill, but working together to make it right benefits those of us who put our confidence in you guys. If the United States of America can work with other countries to make the world a better place, my hope is that Missouri can work together to get this bill passed, expand Medicaid, and make this state a better place for those who need it. Thank you for your time, and if you have any questions, you can go ahead.
Thank you for your testimony. Thank you for being here today. Are there any questions of this witness? Thank you, ma'am. Thank you for your trip here this morning. Further witnesses regarding House Bills 1901, House Bill 1239, or House Bill 1969.
Good morning. I'm going to read this because I'm so nervous. My name is Jerry Landon. I live in Sunrise Beach, Camden County, Missouri, with my husband, daughter, and grandson. I work 30 hours per week, and I'm a full-time student pursuing my bachelor's degree to increase my employment options. I'm a proud volunteer with the Special Olympics. My husband and I did foster care for years and adopted and raised 4 children. After decades of employment, my husband has become disabled with rheumatoid arthritis. One of our adult daughters is also disabled. She lives with us, as does our 17-year-old grandson, who we adopted after his parents died tragically. I am the only wage earner and caregiver in our home. And I am uninsured because I am in the Medicaid gap. Our household income is low enough that I can't purchase private insurance, but it's too high to get Medicaid. I am anxious about my health every day. If I get sick, who will take care of my family? If we incur medical bills, will we lose our house? I'm a stage 3 cancer survivor since 2001, but I cannot afford my checkups that I'm supposed to get to make sure my cancer hasn't returned. The last time I saw a doctor, he told me I should take medication for high cholesterol. It costs $38 a month. I can't afford that. Those $38 would have to be taken from our grocery money, and I think our family needs the food more. I am also anxious about my grandson's future. Having lost both of his parents, he has experienced traumatic trauma. With Medicaid, he's been able to see a psychiatrist and get the medication that has stabilized him. One of my greatest fears is what will happen to him after his 19th birthday. Like his father, he struggles with major depression and suicidal thoughts. I cannot let myself think about what will happen to him without health care. For myself, for my grandson, for my family who needs me, I ask that you support Medicaid expansion. Please do not make me and the many, many hard-working and uninsured Missourians like me go any longer without health care. Please expand Medicaid now. Thank you. Do you have any questions?
Ma'am, thank you for your testimony today and for making the drive
Thank
here
you.
to Lake. Further witnesses? Can I get a show of hands on who's planning to testify? Can I get a show of hands who is not a regular in this building, who would like to testify today? Okay, if you're a non-regular, you're gonna go first. You're gonna go before we go upstairs. So, and I think we can recognize the regulars, so try to squeeze them in. Go right ahead.
Good morning, Mr. Chairman, members of the committee. My name is Keith Crawford. I'm from St. Louis. I work as a construction manager and consultant in the construction industry. Also relate to finance, real estate, and insurance as they relate to construction. And I'm here to make the business case for expanding Medicaid, and I appreciate the opportunity that you're allowing me. Although I'm here to make the business case, Medicaid expansion is good for business. Please know that I also support Medicaid expansion out of compassion for less fortunate people. Now, because my background is construction related, I won't try to convince you that I know what I'm talking about. Instead, I want to tell you what people who absolutely do know what they're talking about have to say about this issue. It seems appropriate to start with our own Department of Economic Development. Some of you probably already read their report from last month, but I'm just going to repeat the summary. It says expansion of Medicaid eligibility for adults earning up to 138% of the federal poverty level is expected to inject $17.4 billion in new federal spending into Missouri's economy from 2015 to 2022. Expanding Medicaid coverage would create a total of 23,868 jobs over the 8-year period, $9.9 billion in new wages, $14.6 billion in new gross state product, and $402 million in new state general revenue generated by the year 2022. The expansion would support the same number of jobs currently employed in Missouri's real estate sector. Federal spending of nearly $1.7 billion in the first year of expansion would be on a par with what the University of Missouri system paid its employees in wages and benefits during fiscal year 2013. The effects of Medicaid expansion that I see are varied and many. One is that we have a healthier workforce. You know, we have to compete with the other states for people and as for the quality of the people that we have. Let me read this to you. Poor workforce health costs employers an estimated $576 billion a year. 60% of those costs represent lost productivity and wage replacement expenses driven by short and long-term disability and workers' compensation claims resulting from untreated or undertreated chronic conditions. You know, these are things that they get paid for on the job, but they're not really job related. Employers always bear the financial burden of lost work time, no matter how they finance health care. That's from the International Integrated Benefits Institute, a healthcare think tank out of California. There are a lot of elected officials who are weighing in on this, and one governor wants to ask you, how are you going to feel if you have to go into an emergency room? You'll walk in there and see chair after chair of working poor people, hardworking people, knowing that that's their healthcare system, when we could have given them a better answer. That's what Michigan Governor Snyder has to say about expanding healthcare. Of course, you know other governors who have expanded Medicaid include New Jersey's Chris Christie, Arizona's Jan Brewer. Of course, Rick Snyder that I just talked about, Ohio's John Kasich, and Nevada's Brian Sandoval. Another leader has something important to say about expanding Medicare. The normative problem in many programs, including Medicaid, is that they penalize families for getting ahead. When you get over that 100%, you get nothing. The complex web of federal programs and sudden drop-off in benefits create extraordinarily high effective marginal tax rates, which reduce the incentive to work. That's House Committee Chairman Paul Ryan. The effects of expanding Medicaid will enable us to keep down our medical expenses by having preventive care available to people. This is a story from the St. Louis Post-Dispatch about a teacher. She had health care. She was able to get her colon cancer diagnosed and be cured. Had she not, she still had health care. She'd have been treated. The people who don't have Medicaid or some other health care would not have been diagnosed until it was too late, and they would cost our system a lot of money and lose their well-being. When we talk about the kinds of businesses that can benefit from the Medicare expansion, I want to use this company as an example because it's innovative. It's called EnviroPack, and they wouldn't fall under the under 50, so their people now would not qualify for Medicaid. But they've just gotten there. They only have 52 employees. And what they do is innovative and environmentally friendly. They make egg crate-like packing for industrial equipment out of recycled paper products. Something like large egg crates. They custom made, custom molded for industrial equipment, and it reduces the amount of packaging and recycles existing paper. That's the kind of company I expect to be attracted to the Northside Regeneration Project that we have in St. Louis. And Missouri's already invested heavily in that with tax credits. And the people, the McKee family, have invested a lot of their money. They have to be able to compete with our neighboring states with a healthy workforce. If we get back to that compassion that I said that I have for the less fortunate, I want to tell you what some other people have to say about it. When you die and get to the meeting with St. Peter, he's probably not going to ask you much about how you did about keeping government small, but he is going to ask you what you did for the poor. You better have a good answer, says Governor John Kasich. We all know what it says on here, in God we trust. In my Bible, in the book of Proverbs, chapter 21, verse 13, it says, whoever shuts their ears to the cry of the poor will also cry out and not be answered. I thank you for allowing me to testify on behalf of this bill, and I would be happy to answer any questions you might have.
Thank you for your testimony. Thank you for taking the time to be here this morning. Further witnesses who are not regulars.
Good morning. I appreciate the opportunity to speak to you guys today. My name is Todd Holtz, and as a volunteer for the National Multiple Sclerosis Society, I would like to go on record in support of House Bill 1901. the National Multiple Sclerosis Society strongly supports Medicaid reform that includes Medicaid expansion to 138% of the federal poverty line. Now, in my written testimony and clearly through verbal and written